Fox 5 News Special Report.
Good afternoon, everyone, and thanks for joining us. I'm Maria Arcega-Dunn. This is a Fox 5 News Special Report. Happening right now, San Diego County leaders now providing their daily update on the coronavirus situation here. Let's listen in live.
Staff worked through the weekend to review some of the guidelines, and we are excited to announce that some of these activities can be relaunched immediately with restrictions, and that other activities will be reopening by the end of this week. As someone who has worked very hard over my lifetime to create more parks and trails and open space and campgrounds, I'm particularly excited to announce the resumption of several activities allowing us to enjoy the outdoors. Effective immediately, the following activities can reopen: day camps, campgrounds, RV parks, and outdoor recreation, including sports fishing and private charter boats. I've been hearing a lot from these two sectors, so I'm sure they are delighted to hear this good news. And again, each activity will have its set of guidelines and restrictions. For example, in day camps, activities need to be redesigned for smaller groups, and furniture and play spaces would need to be rearranged to maintain separation. As for sports fishing and small group charter operations, they must ensure customers have access to hand washing facilities or proper hand sanitizing while on the vessel. We know these restrictions will take some getting used to, but they are a small price to pay for allowing us for the reopening of these activities. I want to thank all the businesses who are working to reopen safely. We know it's been frustrating. I and my staff had many phone calls with the Port of San Diego and representatives of the sports fishing industry, and we're excited that soon you'll be able to cast some lines in our local waters. For consumers who use these services, I would encourage you to check with businesses and organizations before trying to book a fishing trip or a camp program. As we move further into the reopening, the changes are going to come fast. To check what has reopened and what hasn't and what is soon to come, visit the Safe Reopening page on our website at coronavirus-sd.com. Also, as previously mentioned, starting tomorrow, more activities, more active recreation will be possible on our beaches, including volleyball and tossing a football or a frisbee at the beach within your household. Additionally, local jurisdictions will have the ability to open up beach parking lots and piers. I have to tell you, though, that the opening of these facilities is up to each jurisdiction, so please check first before packing up the kids and the towels. Excuse me. Our public health order is being updated today and will take effect at midnight to allow these changes to go into effect. The timing couldn't be better with the weather about to heat up, so we hope families will be able to enjoy our beaches. We appreciate the coastal cities who have worked so very closely with us to ensure a smooth transition. And of course, let me thank all of you for making this possible. San Diegans have taken to heart our directions to practice social distancing and good hygiene, and this has allowed us to keep the spread of COVID-19 under control, which is allowing us to move forward with these changes. Thank you for your patience. Now, to go over the specific list of businesses and activities opening later this week, let me introduce Supervisor Nathan Fletcher.
Thank you, and good afternoon. We certainly appear to have had a very peaceful weekend, which is encouraging for us as a region. We also know there is considerable excitement around the advancement through the reopening stages and phases, and we certainly want to encourage folks to get back to work and get back to work responsibly. I do want to add a cautionary note that we really as a region need to continue to be mindful of our actions and of the steps that we're taking. We do this in an attempt in order to continue our reopening and continue a smooth transition as we come out of coronavirus. There is a fairly significant lag between the spread of coronavirus in the community and when we will detect it through the various methods that we utilize to monitor what is happening. And so we want to be mindful that although our numbers continue to be relatively flat and generally stable, we want to be mindful that increased activity and increased openings does provide the increased opportunity for spread. We've certainly seen examples of Los Angeles County, San Mateo, and others that are seeing an uptick in their cases, and we want to make sure that that's not us here in San Diego. And so as we continue down the reopening path, we want to make sure we're continuing to be mindful of all of the various types of things that we have asked folks to do. Physical distancing, hand washing, face coverings, temperature checks. Those four things in combination with an increased availability of testing, tracing, and treatment are the things we think that will allow us to manage the spread in a way that preserves the integrity of the healthcare system and allows us to continue to move forward. So we want to celebrate and be excited about our continued progress, but be mindful that our continued progress is predicated on our ability to show continued efficiency in slowing the spread to a manageable level. And so we want to be mindful of both of those as we move forward. Supervisor Cox mentioned the businesses that are opening and are cleared to go now. I want to cover just for a few minutes the businesses that will be able to open effective this Friday. Over the weekend, our public health officer, Dr. Wilma Wooten, and her team reviewed the public health guidance that were put out by the state of California last Friday and have determined that San Diego County can proceed with these modified reopenings effective Friday, June 12th. Between now and Friday, if you're a business who is on this list, and I'll cover the list in just a minute, we want you to carefully review the state guidance for your industry, put in place, have that guide you're thinking about reopening, and we want you to physically complete the county safe reopening plan, which you can download from our website, complete it, share it with your employees, post it outside your place of business at whatever point you choose to open as early as Friday morning. I'm going to walk you through graphically where you can find this information on our website. So if you go to our website, coronavirus-sd.com, there's a pretty simple 4 steps here that you can take in order to be able to do it. The first is you'll click there on Safe Reopening, which you will see right there. And then under Safe Reopening, you can see right there the various plans. Step 1, refer to the guidance for your specific industry. Those are the ones that have been put out by the state. Step 2 is the safe reopening plan that you will print and fill out. Open now, at the bottom there of stage 2 are those entities that are still open. If you probably know who you are, you're probably already open. The ones that I'm going to talk about here today will be under the Coming Soon tab. These coming soon things are things around schools, music, film, and TV production, professional sports, gyms and fitness facilities, restaurants, bars and wineries, primarily bars and wineries, hotels, which do include Airbnb rentals, card rooms, satellite wagering and racetracks, family entertainment, including bowling alleys, museums, galleries, zoos, and aquariums. You can click on that guidance, and that will take you to step 4, which will be the guidance. The one we highlighted there is gyms. If you click on gyms, and you can see in step 4 what it clicks to. But it is important as we move forward that folks are mindful of the state guidance and of the safe reopening plan. Again, to reiterate, effective Friday, this Friday, the following entities can open, provided they complete the county safe reopening plan and use the state guidance. Gym and fitness facilities included in that are swimming pools, as they're related to fitness facilities, condos, HOAs, or community pools. Those are able to be open on this Friday as well. Bars and wineries, card rooms, family entertainment, museums, galleries, zoos, and aquariums, and hotels for tourism and individual travel. Each of those entities are cleared to open this Friday. What is not yet open in San Diego County or anywhere in the state of California are nail salons, places to get facials, tattoo parlors, therapeutic massage businesses, movie theaters, and then conventions and concerts are the ones that have been talked about in stage 4. We'll continue to stand by and work with the state of California around additional guidance around those stage 3 entities, nail salons, the ability to get facials, tattoo parlors, therapeutic massage businesses, and perhaps movie theaters. We will see in the coming weeks from the state of California guidance coming out. But again, all of those entities that I mentioned earlier will be a part of what will be allowed to move forward on Friday. And again, as we continue to have continued reopening, we just implore the public to continue to adhere to the public health orders, and let's continue to be a model county, both for how we dealt on the front end with the coronavirus pandemic and how we are dealing with the reopening process as we come out. Jumping quickly into our metrics for today, testing down a little bit, it always is on Mondays. We had some really significant numbers over the weekend that bumped up our average, 3,844, but our rolling 7-day average is at 4,567, getting incrementally closer to our initial goal of 5,200 per day. Contact tracers and investigations you see there. Today's percentage of positive, we're reporting 143 new positive cases out of 3,844. This puts us at a 4% positive out of those tested. Yesterday was 2. The preceding 3 days were 4%. So a slight uptick in what we're seeing as a percentage of positive. Our rolling 14-day average there is at 3.1%, and so we will keep an eye on that. Daily hospital census stays relatively flat. ICU is essentially what they were yesterday. Hospitalizations down just a touch, relatively flat and stable. Same is true with overall hospitalizations, down a little bit yesterday to today, and you can still see the total hospitalizations there relative to the 80% bed capacity, which you see right there. So down just a little bit, but again, staying relatively flat over the course of the last month, as you can see reflected on the chart. And then ICUs continue to fluctuate a little bit day over day. COVID-related ICUs staying relatively flat, non-COVID kind of going up and down, but at a percentage bed occupied of 64%. That concludes my update. I'll now turn it over to Dr. Wilma Wooten for the Public Health Officer's report.
Thank you, Supervisor Fletcher, and welcome everyone, and thank you for your attendance here today. The Johns Hopkins dashboard provides the source for the data that is shown here on the slide. And the information includes over 7 million positive cases, including over 404,000 deaths. Nationwide, the United States is reporting almost 2 million positive cases, now at 28% of the global number, and includes almost 111,000 deaths. Statewide, California is reporting over 131,000 positive cases, which includes 4,633 deaths. And today, the County of San Diego is reporting 8,619 cases, which is 143 more cases than yesterday, as well as 296 deaths included in the overall total. There were no new deaths reported since yesterday. The age range is unchanged from 3 months of age to 102, and the age range 20 to 49 years of age is increasing ever so slightly, a couple of percentage. Now we are at 53% of the total number of cases of people that are 20 to 49 years of age. The age, or rather gender, females are now at 51% and males are at 49%. And 1,429 individuals have been hospitalized. This represents 17% of the total number of cases. Of that number hospitalized, this includes 403 individuals that have been admitted to the ICU. This number is 5% of the total number and 28% of those hospitalized. As of June 7th, the county has surge capacity, as shared with you by Supervisor Fletcher, for hospitalizations at 36% and for ICU admissions at 36%. The 296 deaths represent approximately 3% of the total number of cases, and of these deaths, 42% are female, 58% are male. 282 had underlying medical conditions, and this represents 95% of the total deaths. 13 had no underlying medical conditions, which is 4%, and one case is still pending information regarding underlying medical conditions. We have data for 97%, which is 288 of the 296 total number of deaths for race and ethnicity, which means we do not have race ethnicity data for 8 of the 296 deaths. 124 or 43% are Hispanic or Latino, 123 or 43% are white, 30 or 10% are Asian, 8 or 3% are Black or African American, 1 or 0.3% are Pacific Islander, 1 or 0.3% is American Indian, and 1 or 0.3% is of multiple races. My sincerest sympathies and condolences go out to the family and friends of those deaths that we have reported here today. And as a reminder, all of our statistics can be found at the bottom of the slide as shown here, and also on the sign in front of me. In the next 2 slides, I would like to provide an overview of the EPI curve and a comparison of the number of cases by week and then over the past 14 days. This slide shows our EPI curve, which is cases by date of onset of illness. And you can see that the largest number of cases were between about April 20th. The largest number of cases for any one day was between April 20th up to about May 6th. So as stated previously, this appears to be where we have peaked, but the area under the bar could have more cases because that's the 14-day incubation period. So again, we will continue to monitor and report any additional cases as they occur. Now the next slide is the number of cases among San Diego County residents reported, new cases by date reported. And on the left side, you can see from the beginning of the outbreak or pandemic, we have the cases by weeks. So in the last 5 weeks between May, or rather April 18th and the 22nd of May, numbers for weekly new cases were from 790 to 800 or 900, and I can't see that very well, but in the upper 800s. So that's for up through the second week of May. On the right side, you can see daily number of cases that are shown, and there's a bit of an aberration on the 6th of June, where we have 240 cases, and that was due to additional batches of cases being submitted. So that basically has thrown off our first metric, and we will talk about that, but this is not alarm the trigger, if you will. This is just an aberration in the number of tests performed, which is a caveat as stated in the trigger. Now, since the beginning of COVID-19 in San Diego County, we can go to the county seal. There have been 97 cumulative outbreaks in congregate and community settings. Of the 97 outbreaks, 43 or 44% are now closed and classified as inactive outbreaks, meaning there have been no new cases in these various facilities in the past 14 days or longer. Of the 97 outbreaks, 54 or 56% are active outbreaks, which includes 19 skilled nursing facilities. There have been no new outbreaks reported since yesterday, and with the total number of skilled nursing facility cases at 802, or 9% of the total COVID-19 positive cases, and this also includes 85 deaths, which is 29% of the total COVID-19 deaths. As it relates to the other non-skilled nursing facilities or other congregate settings, we have 24 active outbreaks. There have been no new outbreaks in this category or types of facilities since yesterday. This includes a total number of aggregate cases at 857, or 10% of the total number of cases, which includes 67 deaths, or 23% of the total number of deaths. And finally, 11 active outbreaks are in community settings, and there have also been no new outbreaks since yesterday, and this includes the total number of cases for this category includes 386 cases and 5 deaths. So as shared several times last week, the county is aggressively assessing triggers for modifying the health officer's orders, and as we begin to open up, this will be even more important. There are 13 criteria that have been developed across 3 categories, and these include epidemiology, healthcare, and public health. As I stated earlier, the first trigger is elevated due to the increased number of tests that were performed. So this is not an opportunity to ring the bell, if you will, but an aberration of the increased testing. Over the next couple of days, when we are consistent with the number of daily testing, this number will return to less than 10%. So the health officer's orders will be modified when any one of the 3 criteria are met, and this includes community outbreaks, personal protective equipment, or ICU capacity, or when one or more of the remaining criteria in at least 2 of the 3 columns are met. But in actuality, if any one of the triggers is uniquely elevated, we will look more closely at what are the causes associated with that, and if any of the other triggers are related. So the counties, as I've shown you the county's triggers and share with you, we are happy that all 2 through 13 are green, and the first trigger is only elevated because of increased testing. So locally, as we reopen businesses and increase activities, we must continue to be vigilant and maintain the effective strategies that are needed to decrease the spread of COVID-19. These include practicing good hand hygiene and environmental sanitation, maintaining 6 feet social distancing when you are in contact with individuals outside of your household, and using a face covering, and the 4th is conducting screenings, particularly in businesses, schools, and places of worship. These are all public health best practices to prevent the spread of COVID-19, and each of us is responsible and has a role to play to make a difference in ensuring that our COVID-19 cases do not increase.